You are watching Issues at Hand on Church of Uganda Family TV, proudly brought to you by Protea Hotel Entebbe. My name is Bruno Edgar. Thank you for joining us today. Now, the Ebola outbreak has brought challenges when it comes to the health sector in Uganda, and when it comes to the health, health and safety to the public and to the citizens of Uganda. So it's very, very important that we continue to have this discussion on Ebola, how to protect ourselves, and then how are the health workers protected? Are they safe? Are they safe as they lead this fight against the Ebola virus disease? And now it is a scourge. It's an outbreak that is bringing a lot of issues. So we are going to discuss the issue of the protection of health workers as they lead the fight. Now, you might wonder why we are having this conversation now. According to the newspapers, the Uganda Medical Association has clashed with the Health Ministry over risk allowance and compensation plans for health workers managing patients with Ebola virus disease. Now, addressing journalists in Kampala yesterday, Dr. Samuel Oledo, the Uganda Medical Association president, said health workers who are treating Ebola virus disease have not yet signed or received any risk allowance from the government. And this is what he had to say. The Ministry of Health has not provided a clear compensation plan for health workers who are dedicated and risking their lives at the front lines in this tough battle against Ebola virus disease, a disease with a very high fatality rate. Now, Dr. Oledo also said this has demoralized their colleagues and affected the quality of care being offered to patients. Now, let the humility, the sacrifice, and ability of health workers to give themselves to serve the nation not be taken as a witness of ignorance or inability to understand why they are what they rightfully deserve. When it gets out of hand, we shall also get out of hand, which we do not think you would wish us to do. Now, 2 health workers have died of Ebola, while 65 have been quarantined because they are contacts of the victims or were exposed to the virus, according to information from the health ministry. One of those doctors was a Tanzanian doctor who was operating a patient when it came to Ebola, and unfortunately he succumbed to this disease. And that is why we are talking about the fate of health workers when it comes to the fight against Ebola virus disease. Now, my guest today, who is going to help us tackle all these issues of compensation when it comes to health workers, of their safety when it comes and protection. Do they have the requisite procurement of equipment when it comes to their health and safety? My guest today is Dr. Daniel Ojlong Snr, who is the Intern Welfare Representative in Uganda Medical Association, and is here also going to tell us why the Uganda Medical Association last week came out to say that health workers, if the equipment is not sufficient enough when you are tackling Ebola virus, when you are treating patients who are positive with Ebola virus, stay at home, do not go to work. But first of all, thank you for joining us on Issues at Hand this morning. You are very welcome, and we are glad to have you.
Thank you so much for hosting me, and thank you for giving us a platform. Good morning, fellow Ugandans and fellow colleagues at work. I want to thank you for the work that you're doing to help save lives in amidst this outbreak, amidst the challenging environment has been put before us. Thank you so much.
You're welcome. Now, take us through first and foremost the mandate of the Uganda Medical Association, as well as the mandate of the Federation for Uganda Medical Interns.
Thank you so much. I will speak largely for Federation for Uganda Medical Interns, but as you had already indicated, that I am a representative for Interns in Uganda Medical Association, I will speak a little bit about their mandate as well. Uganda Medical Association is an association that brings together 8,700 doctors, both in Uganda and without Uganda, and it has a twin mandate of ensuring health worker welfare and professionalism, as well as ensuring that Ugandans whom we serve have quality health and healthcare services. Uganda Federation for Uganda Medical Association, on the other hand, is an association that brings together graduate medical interns. These include doctors, nurses, dental surgeons, midwives, who are undergoing a mandatory 1-year internship period as stipulated by the Ministry of Health. So our task is to ensure that they get adequate training during this 1-year period, and also their welfare is taken good care of, and that's what we do. Thank you.
Wow. And what are the key objectives when it comes to Uganda Medical Association, especially when it comes to outbreaks such as the nature of the Ebola virus outbreak? And secondly, who subscribes to both these organizations and how?
Thank you so much. Both associations are subscription, like you indicated. Uganda Medical Association is for those doctors who have finished the mandatory 1-year internship after medical training and are out there working. So they need to pay a membership fee, and then they become members of the organization, from which they benefit all this. They benefit from a united voice that champions their issues of welfare and also ensures that they work in a safe environment. It is the same thing with Uganda Federation for Uganda Medical Association, that we want to bring, because we feed Uganda Medical Association, we want to bring together these Ugandans who are finished their training. They are not students. There's a common misconception in the public that interns are students. No, these have graduated and have their papers, but because they are going to deal with life, they have to work under supervision for the 1 year. So we want to bring them together and make sure that there are issues that pertain to their training are addressed, and also issues of their welfare. You may have heard from the media in the past few years that they were not being compensated commensurately. So they came together and demanded for compensation, which was increased. And I want to thank the government for it. I want, on behalf of Federation for Uganda Medical Interns, thank the President of this country, the Ministry of Health, and all other government bodies for enhancing this allowance. However, we are here now that there's an outbreak. During this outbreak, we mobilize our colleagues to make sure that, one, there's a saying that dead men do no good deeds. First of all, protect the carer. We mobilize them and educate them on how to protect themselves in such outbreaks. It is not only during these outbreaks. During health work, it is routine. There's what is called universal health precautions. You need to wash your hands, you need to keep a distance from infectious persons, and all these other things. So during outbreaks, this is enhanced. We also make sure that health workers are trained on appropriate prevention things, so that, because it is a circle, the health worker can give the patient a disease, the patient can give the health worker a disease. The third issue that we do during these outbreaks is make sure that every worker is entitled to compensation, risk allowance, by virtue of the job that you're doing. And from the press conference yesterday, you may have heard that health workers, right from the time of COVID, this country has faced COVID before. We were in a lockdown for 2 years. It's unfortunate that health workers have not yet gotten this compensation up to now. And so our mandate is to ensure that we engage the government and other authorities that are responsible to make sure that these health workers receive and sign for this compensation allowance. This compensation, there's a risk allowance for those who are working during the time, and then there's compensation for those who may die. Death is real. It's unfortunate that we lost a colleague of ours, and another colleague is very critically ill right now, an intern, and we want to probably take a moment to pray for his soul. He was from Tanzania, but he's one of us. He was serving Ugandans. He was a full doctor, what is called a senior house officer. These are doctors who have finished their training and are now training to be specialists. So this colleague of ours unfortunately lost the battle. So during these times, we want to make sure that there's a plan for compensation for the people you leave behind. They depend on you, and when you go away, what does the government do? What does the employer do? What do the authorities do? And this is why we are here, raising our voices to raise such issues. Thank you.
Definitely, definitely. Now there are so many issues to go through, and we shall start there, because going back to what the president of Uganda Medical Association said last week, he said that health workers, if there is no protective equipment as far as Ebola virus is concerned, stay at home, do not go to work. But that, of course, and we'll get into the feasibility of that order, because people need to get treatment so that this virus does not spread further. But then the government, an official from the Ministry of Health came out to say that the protective equipment is there, PPEs are there, and they are adequately stacked in number. So why is it that we have lost these 2 health workers and we have another health worker who is in critical condition? Is this equipment not working? Is it not enough? What is the reason as to why we are losing health workers in this fight against Ebola?
Thank you so much. Let me, for the benefit of the public, enlighten. The President, His Excellency Yoweri Kaguta Museveni, addressed this country on a number of issues, and I'm glad to say that he raised the issue of PPEs. Not being a medical doctor, he likened PPEs to only gloves. Personal protective equipment is the full meaning of that word, and it includes all equipment that enables creating a barrier between the health worker and the patient, so that there's no exchange of these fluids. Ebola spreads through contact with body fluids of an infected person. It could be saliva, it could be semen, it could be vaginal fluids, it could be sweat, it could be urine, it could be vomiters. So I want the public out there to know that you are at risk. If you get a person who is infected, you may not know that they're infected. So avoid touching beddings of anyone who has died in mysterious circumstances, touching their fluids, because this can spread to you through open cuts in the wound, can falling on your mouth, in your eyes. So because this Ebola and other diseases spread in this form, there's need to create a barrier between the person who is treating this person, so that there's totally absolutely zero exchange of these fluids. So personal protective equipment includes gloves, includes gowns, includes face shields, includes masks. If I had Ebola here and we are this close, then my saliva can reach you. That's why there's also need to keep that 1 meter distance. We have been used to this during COVID. Thankfully, this information went out. I encourage the public to adopt the same measures that we had during that time. So going back to your question, PPEs for protection of health workers are in 4 levels. There's level 1 up to level 4. Level 1 are the basics, the gloves that I need to put on before I examine you, for example, when you come. And then we move on into aprons and others. Level 4 is now where someone is confirmed and I'm in the treatment facility dealing with a confirmed Ebola case. So there are levels of these PPEs and they are not enough. I know the ministry has done its best, and currently in the Mubende belt this could probably be enough. But we know that the other day a patient showed up in Kasangati, another person showed up bleeding in Masaka. Now, across the country, since we have not locked down the Mubende belt, I am not saying my bosses will decide and the country, the government, if a lockdown is needed. But since we have not restricted movement from Mubende to other areas, it is only a matter of time before a case shows up in Karamoja, for example. What are those health workers going to do? Yes, they have basics, gloves, but sometimes even these may be out of stock. That's why we're saying we as health workers are willing to go and work. However, like soldiers, let's not be sent to battle without the necessary weapons. So this is the situation on the ground. Let it be spread across the country and in good numbers, because these are going to be single use. You're not going to. There are only a few maybe gumboots that you're going to
that you can reuse,
wash off and reuse. But the gloves, you're going to use them once and throw them, because there are so many numbers. We are serving a population of over 45 million Ugandans. So this need to be enough in the facilities so that these health workers who have sacrificed themselves to protect Ugandans can be protected, so that they can serve well. Like I said, dead men do no good deeds. If the health worker is dead, then you, the public, will not get treatment that is needed for you to survive.
That's true, and you mentioned an interesting word there, lockdown. Going back to that discussion of the lockdown. Now, the president, during his address last week, came out to say that there will be no lockdown because Ebola is something easy that they can handle, that the government of Uganda has handled before. But as a health professional, do you think that a lockdown of the areas of Mubende and the surrounding areas is required?
I will not speak for the government and the Ministry of Health. That's a decision that can be taken at those higher levels. However, if indeed the president said that Ebola is easy, then it is not true. I want to say that the current Ebola is caused by a virus that has 5 strains. I think 6 strains. You have Ebola Zaire, which was the first discovered near Ebola River, where the virus gets its name from. You have Ebola Sudan virus, which is the one currently affecting us in Uganda. We have Ebola Bundibujo virus, which affected us sometime, I think, around 2013. I may be wrong. We have Ebola, it formerly was called Ebola Cote d'Ivoire, but it's now called the Thai forest virus. And then you have the others that don't affect human beings, the Reston virus, which is the only one discovered outside Africa in the Philippines. And then you have the Bombali virus. So of these 4, we have seen for the Sudan strain, these 4 that I mentioned, the Zaire, the Bundibujo, the Sudan, and the Thai forest, these affect human beings. And the Sudan strain that is currently affecting us in Uganda is from previous outbreaks, has had a fatality rate of 41 to 100%. What does this mean for the benefit of the public? Fatality rate means, for example, out of every 10 people, if it is 41%, out of every 10 people that get infected, 4 die. 100% means out of the 10 that get infected, all the 10 will die. It's quite a serious disease that we should not play around with. Okay, and Uganda has had, I think, according to the Ministry of Health, 5 outbreaks, and Sudan strain has contributed to about 4 of those outbreaks. So the first one in 2000 and the one that followed thereafter. So these have all, from statistics, shown a very high fatality rate compared to maybe even COVID that we had before. So it's a serious disease that we need to all watch out. And allow me to talk to the general public directly. Ebola is a very serious disease that, as I already said earlier, spreads through contact with fluids of any person who is infected. It could be saliva, urine, vomit. Ebola also stays long in surfaces, doorknobs, all things that a person who is infected has touched. So avoid touching these things and keep a distance, because if I'm coughing and I'm sick and you're nearby, this can fall in open skin, in your eyes, in your mouth, and you can still get Ebola. So let's help protect our health workers, because without them we will all die. So when we take care of ourselves, then we're able to limit these numbers. And let's listen to information from the Ministry of Health. And one may ask, so how do I know that I have Ebola? So Ebola has signs and symptoms that the Centers for Disease Control and Prevention of the US calls, there are dry symptoms, you have then later on in the disease you get what's called wet symptoms. So the dry symptoms will have a sore throat, you have a headache, you have muscle weakness, and this is intense muscle weakness and feeling tired. Then later on in the disease you start vomiting, you start having diarrhea, you start having bleeding from any body orifice, eyes, nose, but not every patient will bleed. So with the current Sudan strain of Ebola, it's estimated that about 90% of patients will present with fever. So I encourage Ugandans to use their mosquito nets, because the presentation of Ebola mimics the presentation of typhoid, malaria. So we do not want to get you come to hospital with a high fever, then we isolate you and mix you with people who are possibly having Ebola, because when you have isolation units, we usually put patients in one side. So when you protect yourself from these other diseases, typhoid, which have symptoms in the initial phase which mimic Ebola, you are protecting yourself and your family. So let's watch out and let's protect ourselves.
On the issue of compensation, now according to the what's happening on the ground is that especially from COVID-19, the compensation, the risk allowance, so-called risk allowance, is 80,000 shillings. Is that so?
Yes.
And it's supposed to be paid by government to health workers who are leading the front line when it comes to tackling this outbreak. Now there are the medical professionals are coming out to say that this risk allowance is not being paid, or for some it might be it's being paid to other doctors, especially from the public sector, and others are not being catered for. And then there are others still who are saying that it's being paid, but majority of it is being taxes are being removed from that payment, and so it reduces from 80,000 to 50,000 shillings. But help us understand as viewers, what is this risk allowance for? How important is it to the doctors, and what is your advice to government when it comes to ensuring that this allowance is given to the health workers who are on the ground?
Thank you so much. The issue of risk allowance is catered for under the laws of Uganda. The Workman's Compensation Act of 2000 ensures that any worker who gets an injury in the course of doing their duties is entitled to a risk allowance, given the kind of job that they do. And also goes ahead to state that any health worker who loses their life during the course of carrying their duties is entitled to payment of their monthly salary times 60, which is paid to their dependents because they have been depending on this person. So the risk allowance that Minister of Health was paying to health workers during the COVID-19 was about 80,000 per day. But like you rightly indicated, this was also subject to tax, and it was not paid on a daily basis. It was paid per duty. So if I work for 3 days in a week, that's supposed to be 80 times 3. But like you said, it was subject to tax. But unfortunately, even this was not forthcoming. I have testimonies from fellow health workers who worked during that period of time, and they are very distressing. We may not probably share them here, but we are saying currently, for people to be encouraged and motivated, let's have a plan, a clear compensation plan, and let people sign and be guaranteed to receive this risk allowance, so that we encourage more people to go and attend to these patients. Currently on the ground, most people are shying away, because I know if I died, then I think of my 3 children in my case at home and say, who will take care of them? Okay, they are still young, they are barely out of baby class. So when you think about this, people develop cold feet. In our training, we are trained and with the awareness that like soldiers, that we could die in the course of our duties. But this certainty will be helped if we know that if I died, the system that I work for and the government that I work for is able to take care of the people that depend on me, because then. But we have heard of stories where, from the press conference yesterday, you had the president of Uganda Medical Association say that they are receiving calls from families of the colleagues who died, asking them, but Uganda Medical Association doesn't have such resources to take care of families. So this risk allowance, we are saying, let the people who are currently taking care of these patients be given contracts stipulating how much they are going to get, and then let's follow through and pay them, so that they are encouraged and others are encouraged to join them, because they are taking care of Ebola patients involves lengthy hours. Therefore, it's going to demand a lot from the health system in terms of numbers, because if usually you've been working 8 hours, then you're going to stretch, because these patients need round-the-clock monitoring. Now, the other issue that was sticking is a senior house officer that in my earlier submission, I said, these are doctors who are specialists in the making. They are doctors undergoing specialized graded training, and they are supposed to be compensated. Currently, according to the president of SHOs in Uganda, yesterday, he said there are over 1,000, but the government is only paying about 60% of this. So the other 40%, especially those from private institutions like Kampala International University, are not being paid. So, in the case of Dr. Ali, he was Tanzanian, therefore not even Ugandan, so may not qualify for payment, and he was giving a service to Ugandans and paying his institution to give this service. He has died. We are not sure what is going to happen to his family. On a humanitarian grounds, the law is clear that, and this spells this out, who qualifies. And that will take me to the issue of interns. We are saying the interns are young doctors. They are currently not fully knowledgeable in carrying out these duties and are supposed to work under supervision. That's why they are given that 1 year for them to be able to gain experience. Currently, given the current situation, the interns in Mubende, for example, raised concerns which were genuine, that we have no supervisors, because either supervisors have left the station or are busy taking care of Ebola patients who are not getting enough supervision. Also, being inexperienced, they are at risk of contracting the disease, and this is going to increase the numbers of the patients that we have to take care of if we keep them. So they are asked the ministry that please let us be transferred to a new site, so that we can be able to gain this experience in a safer environment. Then the minister said, no, this is part of your exposure. That rightfully so. Then we asked that let this be trained, let them be given personal protective equipment, so that, and let them be adequately supervised, so that they don't go ahead and contract these illnesses. So, following the death of Dr. Muhammad Ali, may his soul rest in peace, the leadership of Federation for Uganda Medical Interns assessed that these have not been provided, and there's an element of intimidation from seniors. So we wrote, Federation for Uganda Medical Interns wrote to the permanent secretary asking that let the interns be isolated who are in Mubende, because the reason there is need for the isolation is there's no intern hostel or accommodation in Mubende, so these interns live among the community and mixing with the community,
which is very dangerous.
Which is very dangerous for their health. So let them be isolated for at least 21 days, and let's assess them. Those who will be tested negative be transferred to other sites. Those who will test positive, let's give adequate care. And I want to emphasize this. There have been a number of issues, probably in other platforms we will discuss this, with the care that those who are infected are currently receiving. I request the authorities, if there are cameras in these treatment facilities, let's look at them and ensure that these people are actually being monitored and getting the requisite treatment. It is my humble appeal. There are stories that maybe yesterday the president for Uganda Medical Association requested audience with the president of Uganda, His Excellency Yoweri Kaguta Museveni, so that we can discuss a number of these issues in detail. We cannot start trading blows in the press. It's like washing that linen in public. These are genuine concerns that need to be concerned. So the letter I talked of being written to the permanent secretary was requesting that let these people be taken out and given training so that they work in a safe environment. But also, there's an aspect that is often ignored, the mental health. In the medical profession, there's something called circle of care. Most of the time, we think that care should only flow from health workers to the patients. But even doctors need taken care of. And this has shown that we need to take care of our own. Okay? When a doctor is well taken care of, then it's going to be, it's a circle. I am taken good care of, I take good care of you, I take good care of the patient, and all of us benefit. So, this is our request to the government that let's look at concerns of interns genuinely and concerns of doctors genuinely, and let's have, in any case, the people running the Ministry of Health are fellow health workers. They understand these concerns, and it is easy for a meeting of minds to discuss the issues.
And when it comes to the call to health workers who are not receiving enough protection to stay at home, there were some members of public, and in some spaces people were asking, but what about that Hippocratic oath to always treat and always give services to those who need treatment? That yes, we understand that when it comes to health workers, they have families, so they have to be well paid, well compensated for the work, especially when it comes to dangerous disease like Ebola virus. But still, as health workers, have that duty to ensure that treatment is given to those who are sick, because if no one goes and treats the patients who have contracted Ebola virus disease, doesn't that spring problems for our country? So what do you have to say about that?
Thank you so much. I must emphasize here that Uganda Medical Association has not called for their health workers to stop treating Ebola patients, and no intern has said that they're not willing to treat patients who have Ebola. However, we are saying let's be facilitated to do our job properly, and that's what in his words, I attended that conference, a press conference with the President Uganda Medical Association. It was very categorical and said that only when our appeal fails to generate the necessary response shall we consider a plan B. He's called it plan B. He never said that it's going to stop. No. We are asking the government and the authorities to provide personal protective equipment, to train health workers who are on the ground so that we minimize cases of infection among health workers. I want to give you context. The WHO recommended minimum ratio doctor to patient is 1 doctor to 1,000 patients, but that ratio in Uganda is 1 doctor to 25,000. That shows you that we have very few doctors in our facilities attending to a bigger population. So if the few get infected, then you even have far less numbers, and it is the same across other cadres like nurses, like specialists. It's even worse when you go up into specialties. There are specialties in this country where there are only 8 people, or even 1 person
for the entire country,
for the entire 45 million Ugandans. So we are saying we are not refusing to treat, because that's our mandate. You rightly said the Hippocratic oath says do no harm first. But if the one who is supposed to help you is dead, who is going to treat you? So we are saying provide PPE PPEs for health workers, train those who are there, give allowances for those who are in the front line, and those who may die. And indeed, death is not hypothetical. We already have 2 health workers, according to the Ministry of Health. One was a probable case, and it appears Ebola was spreading in the community before it was actually diagnosed. So let's provide this protective equipment, and health workers are willing to work. Even now they're working. You've not heard of patients being neglected, have you? So health workers are doing their job. Let's facilitate health workers and attend to their concerns, and we shall all get out of this. Let's not forget that Ebola brought the entire West African region to a standstill for more than 2 years. An outbreak that started, I think, 2013. So it is that dangerous. If the population does not take heed, and luckily, simple basic measures. Let's not touch people who are sick. Let's not eat animals from the bush. Those people who live near the parks, let's not hunt these animals. Chimpanzees, baboons, antelopes, apes, all these carry the virus because it transmits among them. Then from there, one person either goes and eats them or touches their carcass, gets disease, and then it starts spreading among human beings. The Ministry of Health has done its best, and I know they have a pandemic preparedness plan that, given that we donated expertise to West Africa during that Ebola Outbreak, and unfortunately, we are here asking for money from donor partners, which is okay. But what we are saying as Uganda Medical Association and Federation for Uganda Medical Association, let's have some emergency fund from which we can attend quickly, because these outbreaks are emergencies, and time is of essence. Let's have, as a country, set aside some emergency fund which operationalizes this kind of this situation. So regarding our colleagues who are admitted, the day before, I think Minister of Health through IDA and another person was able to personally go there and deliver certain essentials, which we appreciate. However, we still call that let this monitoring be fully taken, given top priority.
And in terms of
my next point is going to come on that we're also saying that let there be facilities. Health workers be given the good attention they deserve. Let facilities be set aside with the best possible care that's available for these health workers to be treated. So that death is inevitable. We all have to die at some point. But when someone dies, let's say we did everything we could. A colleague said, and I quote one of the colleagues who have been in this situation of illness, that I thought they would be considerate. Let's not have our health workers regret coming to this noble profession. And let's not have parents who have been in touch with parents of our health workers. And one said, I wanted my son to study something that will take him to Parliament. Now, look at where they are. So, it is, the Ministry of Health make sure that our health workers are fully taken care of, so that even when they die later, if it's meant to be, we all say that maybe God had scheduled their time to be, not because there was negligence here and there. And that's one important thing we want to raise, and that's what we're appealing the government to.
Definitely. And when it comes to the issue of isolation that you spoke about, are our isolation units enough, especially when it comes to Muwende Referral Hospital and even in Mulago, enough to cater for the patients that may spring up as a result of this outbreak?
I have not taken stock of what the Ministry of Health will probably inform the nation on how well prepared they are and how much space they have. Remember, we had a similar situation during COVID-19 where we talked of ICU beds, but I'm sure it is much better now because of that time we had a preparedness. However, in Fort Portal, where our colleagues are admitted, there's only 6 beds in that. It cannot take more than that. So if we have more health workers, more than the current number that's admitted there, we are going to have a problem. However, Mubende, I think, has some other space. I do not know about these other places, but the Ministry of Health should come and tell the nation that this is our level of preparedness and this is how much we're able to do.
All right, now, like I said, one of the things we love about Issues at Hand is that we get to hear from you. And so we are going to get into your comments and questions that we have received. And thank you so much for participating in the discussion. And so let me get right into it. I have one Joan here saying, henceforth, what do you think should be done? How and by who exactly? Who should the contact point in such emergency times be? So I think Joan here from Charlie Wajala is asking about what should be done when it comes to risk allowance, when it comes to compensation, what should be done and by who? What exactly should be done according to your view?
Thank you so much. When I began my submission, I quoted the Workman's Compensation Act of 2000, and this squarely places the responsibility on the employer, and in this case the employer is the government of Uganda through the Ministry of Health and Public Service and all these others. These are the ones who are responsible for compensating their workers who succumb, either suffer permanent damage or die in the course of their duties. And the same act goes ahead to spell out how much should be given for each of these cases. So, for example, for a health worker who dies in the course of their duties, that act states that they should be compensated to the tune of their monthly salary times 60 to their dependents. Yes, so the responsibility lies in the government. And what should be done? It is straightforward. Let money be availed so that we don't come to this situation again and again. It's unfortunate that 3 years from the start of COVID, we have health workers who worked tirelessly to save lives during COVID who have not been compensated up to now. And that's why we say, as Uganda Medical Association, let's have this taken care of. And that has dampened. Recently, there was a need for extra hands on board. People are not willing to show up because we may come and we are not being paid for. This time around, we need to sign somewhere. These are concerns that are genuine, and given that we helped a population through a difficult time and then we were forgotten. Remember, during that time, the government, through Ministry of Health, requested for extra hands on board. And these people were brought, I'm talking about COVID, were brought on board to treat COVID. And they were promised to be absorbed into government payroll, permanent employment after that. What happened? These people were laid off. Now, these were exactly the same hands that they were asking, okay, maybe let's have them come on board. But people are not willing to come because of these issues. So we all know where the responsibility should be. We all know what should be done. Let's do the right thing. And let's not be in this situation again and again. Diseases have shown us that they can show up at any point, anywhere. COVID came from nowhere. It put us where where it took us. Ebola has been here 5 times over now. So let's have a clear plan and let's be serious about these issues.
You mentioned that the Sudan strain has been here for some time, and so I want to ask you how far, as a medical practitioner, and I know you might have your ears on the ground when it comes to this matter, how far with the vaccine? President Museveni in his address last week was saying that a vaccine is being worked on, and then there was a report that said that other companies like Johnson & Johnson also working on a vaccine. Do you think that we may be seeing a vaccine against the Sudan strain soon?
Thank you so much. I want to, for the benefit of the public, say that Ebola the Zaire strain currently has treatment and a vaccine. There's a drug called Ebanga, and there's a drug called Inameb. These are, in the scientific parlance, antibodies, meaning these are soldiers that are either manufactured in the lab or gotten from people who have recovered from Ebola, that can be injected into people who are suffering from the strain, and it helps kill off the virus in their body and help them survive. However, tests were done using these treatments on the Sudan strain, and it was not found to be effective. So WHO, in the one meeting that we, through their representative, in one meeting that we held with them, advised that the best we can do currently is supportive management. What does this mean? It means that we need to treat the symptoms of these patients, manage the pain, replace their fluids and electrolytes so that their bodies don't shut down, and keep them comfortable and give them food, because usually when your body is well prepared, those with good immunity are able to stand a higher chance of surviving. So as it stands, I'm not aware of any information regarding the progress on making a vaccine for the Sudan strain, but scientists don't sleep. They're always working on something. As to what the president said, I heard him say that we are going to give health workers this treatment, maybe as a desperate measure. We can try, but like I said, studies have shown that it's not effective. The Banga and Inameb, these monoclonal antibodies, are not effective against the Sudan strain because they were tested and developed for the Zaire strain of the virus.
Well, we hope that the progress of the production of the vaccine that will fight the Sudan strain is quickened. What's your final remark when it comes to the issue of health workers, and what would you like the public to be aware about when it comes to Ebola virus, and what's your one last plea you can make to government on protecting health workers?
Thank you so much. Ugandans, this is a public health emergency. It involves all of us, and each of us needs to play their part. Let's have the right information, and let's practice infection prevention. I earlier on said that make sure that you wash your hands regularly, you sanitize when you can, and avoid touching dead animals, eating bush meat, touching objects that have been used by a person who is confirmed to be sick, or even one that is suspected. If someone is bleeding, please go to the nearest health facility. This Ebola has been managed. Uganda has had a good record that we even lent expertise to West Africa to help them when they had an outbreak. So let's utilize our health system. And for the Ministry of Health, we thank you for what you have done for our colleagues, for the provisions that you've made, but we request that let this be consistent, because if you are admitted and you need fluids, if you get today, that means it doesn't mean you stop needing them tomorrow. It is throughout. Our colleagues, I am in touch with colleagues, one of our colleagues who is there. Their major problem is they need fluids, usually through the vein, because even appetite is not there. So let this be given regularly. Let's monitor the people who are working there. Let's make sure that they go and check on these people frequently, and they get the best service. And thank you for the PPE that are available. Let's increase the numbers. Let's spread out beyond the Mubende belt, because it's only a matter of time before an Ebola case shows up in Soroti or Karamoja. So let's have the health system well prepared. And Uganda Medical Association listed 5 recommendations. This were in the press release, and this was one, compensation, training of the health workers who are there. Let medical interns be withdrawn from these epicenters, because I have already articulated here that they are untrained, they are unsupervised, and these other reasons that were raised. And then issues of compensation takes center stage, and then they request for a meeting with the stakeholders so that these issues can be articulated. The same thing with Uganda Medical Interns. As a federation, we are requesting that let's protect these young health workers. They're the future who are going to replace the current crop of health workers. If we lose them now, then we have a short supply. And that's going to make the situation that I already raised earlier on of fewer health workers attend to big population even worse. So let's take this issue seriously. Let's wash our hands. And I pray that since we're a nation founded on God, let's, in whatever way you can, pray to God to protect us, because we do our work, then God heals. As a doctor, I acknowledge that part, that I am going to be limited in whatever intervention I'm going to give. So, thank you so much.
Thank you so much for coming on Issues at Hand, Dr. Daniel Ojlong Snr. And thank you so much, our viewers, for being at hand as well to tackle these issues with us. Thank you for sending in your questions, and thank you for always being part of the conversation. And now you've heard from Doctor that we need to be vigilant. We need to follow the guidelines and the standards when it comes to protecting ourselves against Ebola virus disease, because it is deadly. And government, please, you've heard the pleas of the Uganda Medical Association. You've had the plea of Dr. Daniel. Please ensure that our health workers are well compensated, that that risk allowance is paid, and that they have the equipment they need that will ensure that they are protected against the virus. Thank you for joining us once again on Issues at Hand. We'll return tomorrow with more interesting tackling of issues. God richly bless you.